a PhD in aerospace engineering. I've been working in that field for over 30 years. Today I was going to talk about the spread of infectious diseases and models used to calculate their progression. In particular, talk about COVID-19. I'm doing this because there has been some discussion in the media that declares that models have been inaccurate. In reality, that's not quite the case. Models are never quite perfect, but on the other hand, if fed the right data, they do give accurate estimations. And the trouble, too, with this particular model is that it is dependent upon what people do, and it will change the outcome. So the name of the model is Susceptible, Infected, and Recovered Model, SIR model. It's more or less an acceptable disease progression model, and I was going to talk about that. So if we look at the ways that you would model things in society, there's really kind of three types of people. There's susceptible people, which means people that haven't got the disease but could get the disease. And so by and large, at the beginning of a disease progression, that's everyone. As time goes by, the people will move on from susceptible to infected. Not everybody gets infected, but a certain percentage of the population will become infected. And then following the infected, it moves on to the recovery phase. So people that are recovered from it, then we'll assume, is the type of disease that cannot get infected again. So they are no longer in the pool of people that could be infected. It turns out in the way of modeling, there's no difference in recovered between getting well or dying, because in either case you are removed from the population that could get the disease. So that's basically it. Three different types of individuals as the disease progresses through society. And we can think of this as sort of on a pie chart to begin with. Most of the population, when we start to track a disease, are susceptible. They haven't had the disease yet. Some people have the disease, and then some people probably even at early points have recovered from the disease. As time goes by, more people will get infected, cutting into the susceptible region, but also some people are recovering from the disease, and as time goes further on, then a lot of people maybe will become infected, fewer people susceptible, and then more people recovering. And then as time goes by, herd immunity occurs and other things. Then eventually most of the population that was infected will be recovered. There'll still be maybe some infected, and not everybody in the society will have gotten the disease. So there'll still be susceptible, but a much less chance of getting it because there's fewer people that are infected. So probably just talk a little bit about estimations, because the basic idea of mathematical models is to try to predict the future, but not do it through tea leaves or other methods like that, but rather through mathematics. So this is relatively simple. If there was a certain number of people, say, yesterday had the disease, and we don't want to give it a specific number, so we'll just say it's I number of people were infected with the disease yesterday. And then we look, and today there's another amount. So there was the I that had it yesterday, but then another amount today, and we'll use the Greek letter delta, which means an increment, and we'll say delta I then is the number of people that got the disease today. So the question is, this is what we want to use models for, is how many people will be infected tomorrow? We want to predict into the future how many people will have the disease tomorrow. Well, it wouldn't take too much thought to think, well, if there was I people the day before, and today there was another delta I people, tomorrow's probably going to be kind of similar today, so we pretty much expect that tomorrow there would also be another delta I people. Now, it's not going to be perfect, it's not going to be exact, but it's better than saying there's like 10 times the number of new infected people tomorrow. That doesn't quite make sense. Or maybe nobody gets infected tomorrow. That doesn't make sense either. So we would pretty much have to say, assuming that the increment is about the same, that the number of people expected to have the disease tomorrow would be how many people today, I plus delta I, and then another delta I tomorrow. So what if we had a whole week's worth of data though? So we say, maybe last Sunday there was a certain number of people, on Monday maybe a few more, on Tuesday not quite so many, Wednesday, Thursday, just a different number of people every day. And the way I chose this example is, suppose just the previous day, say Saturday, there's just a few people had the disease. Now, using what we just said, then we would say tomorrow would be the number of people that we have today, plus that little bit amount that's on the increment due to Saturday. And that's probably wrong because we know that previously in the week there was more people each day. So maybe a better way of doing this is, what if we just took the whole week's worth of people and we average it? So we have 7 days worth of people getting the disease. We take that total number and divide by 7 to get a delta I average. And now we would say then tomorrow the number of people that have the disease is the number today plus that average delta I, which is probably better than just taking the previous day. And of course, maybe we don't want to predict just for tomorrow. Maybe we want to know how many 3 days from now. So we also could say, well, maybe it's the number today and then 3 times the number of daily increment that we saw over the previous week. So now we need to talk a little bit more about just infection. So suppose we have a certain part of the population that's infected, represented here as a one red infected person, and that person goes out and intermingles through the population, getting close to some people, staying further away from other people. And there's a certain probability then that even when that person interacts with other people, that the disease is passed. It's not 100%, even with very close contact. In this case, we'll say the one person there happened to infect 2 people on that particular amount of time. All right, so now let's suppose there's more. So suppose we have the same number of people, but now we have 2 people are infected, or just a double the population. As those people go out and intermingle, we would sort of expect, not completely linear, but we would expect them then to interact with more people and infect more people. So the larger number of people now has infected a larger number of the population. So this is a relatively simple but pretty important equation. It's the exponential growth equation, which just simply means that the increment in the number of people shown on the left side of the equal sign as the change of infected people over the amount of time. So that's like the daily increment of people, or at least the amount of infected people per unit time, is equal to some constant times the number of people have it. And it's really just saying if we have more people with the disease, we expect more people to get infected. And that's the exponential growth equation. It actually shows up all over the place, not just in disease infections. And then put here the term alpha, which is the Greek letter alpha. It's a proportionality constant. It doesn't mean that it's a 1-for-1 or a 2-for-1 or anything like that. It's just a certain percentage of time we expect an infected person to infect somebody in the population. So now we move on to the SIR model. And the SIR model tries to quantify this effect, and it's similar, you can see, to the equation there for the number of infected people to what we just saw, and that is the increase in the number of infected people is equal to a proportionality constant. In this case, it's called the Greek letter beta, and then times the number of people that are infected, I, and then the S over N is just sort of the percentage of people still susceptible in society. The other term we'll talk about in a little bit. Then we see then that as people become infected, then that changes the number of people that are susceptible, because they were in the population as susceptible, but now they've become infected, so we subtract that off from the pool of people that are susceptible, and that's just shown in that equation. And then there's a certain number of people that are recovering, so that just is how many people have the disease, and then we talk about a certain percentage of them per unit time will recover. And remember, in this case, recover means either get well or die, but still be removed from the percentage of the population that is either susceptible or infected. The beta term is kind of an important term. It is actually the average number of contacts that a person has per unit time, and then multiplied by the probability that given a contact the disease will be transmitted. And N is just the total number of population, and then, as I said before, the Greek letter gamma on the recovery is the typical amount of time that it takes a person to recover once infected. That's called the susceptible infected recovery model, and that's generally abbreviated to just the SIR model. So if we talk about, there is a very important parameter, at least early in the progression of the disease, and that is this ratio of beta over gamma. Remember, beta is essentially the transmission and the growth of the disease, and gamma is essentially the recovery of the disease. And so the ratio of the two is very important. That sort of gives you an indication, again, early on in the disease, whether the disease is climbing or falling. Now, the two parameters, beta can be changed by social distancing and other social norms. But the gamma is kind of set by the genetics of the disease. A certain disease, once you have it, the average person will take a certain amount of time to recover and no longer be infected with the disease. So the gamma for a given disease is more or less constant, but the beta is not. The beta is something that can be changed whether you wear a mask or if you deal with social distancing, or if you don't, it'll change that R0 value a lot. So the R0 value is an incredibly important parameter in trying to predict the progression of a disease. And it's not completely like this, but essentially early on in the disease growth, if R0 is greater than 1, then the disease is growing, and the larger it is, greater than 1, the faster it's growing, and the more pervasive into society it'll be. And then if R0 is less than 1, the disease is tending to decrease and therefore not growing. So there's another problem here, and this is one of the challenges of dealing with any infection, including COVID-19, and that is not all people that report are infected. Some people are very, very sick and they go and get tested and they do report as infected, but there is a speculation that there's a certain number of people that do not show any signs, do not get tested, do not get reported in the amount of people that have the disease. And in general, that number can vary, but it's somewhere for COVID-19 looks like somewhere between 5 to 10. That is, for every one person reported, there's another 4 to 9 people that didn't report it. So it is a parameter that you have to choose and maybe adjust as time goes by, and it's not at all certain, but for the rest of what I'm going to talk about, I chose a number of 5. So that is for every one person reported, there's actually a total of 5 people that have had the disease. So if we move on now, if we just look then, what about COVID-19 specifically then? So COVID-19, it looks like for the disease that the parameter gamma, which remember is the amount of time or the number of people per unit time that will recover from the disease, and that is more or less set by the genetics of the disease, gamma's on the order of about 0.38. It was early on in February of 2020 or so, when more or less the disease was going rampant and nobody was doing anything about it. It looked like the R0 value was about 1.8. Remember, anything above 1 means the disease is growing. If you just look at those through the ratio, you can determine then that the beta value for the number of people that are acquiring the disease from the susceptible group per unit time is about 0.86. And if you look at that then, there is this parameter that shows that we start off here with the number of people that are susceptible, and in the beginning that's the entire population, and then as time goes by people get the disease, shown here in the red curve, and so at any given moment the red curve is showing how many people are actually infected with the disease coming from the pool of people that are susceptible, and then of the red disease a certain amount of them are turning green, and in this case that means recovering. So this is just sort of the disease progression, and you can look to see if unchecked the parameters, we can check and see how many people would get the disease per unit time and how many people would get it in total. So it turns out for COVID-19 there would have been, had people have done nothing, there would have been approximately 38 million people would have had the disease all at once at the same time, somewhere near the middle of April. And so there is some implications there that had that have happened, it would have overwhelmed our healthcare services, because in theory you would need beds in hospital care for virtually all of those 38 million. Well, that's not completely true, because this is the full 38 million that have it. Only 1/5 of them, according to this analysis, would actually report and probably feel sick enough to even consider going to a hospital. Turns out that the area under that curve is the total number of people, which is kind of important, and that is then from the time that the disease starts until it ends, it would have been about 239 million Americans would have gotten this disease out of 327 million, so a very large percentage. And then the number of people recover maybe shouldn't be too much of a surprise, is that same number, 239 million, because everybody's susceptible one way or the, everybody that's infected, one way or the other, does recover. Remember, recover means both getting well or dying. So of the amount of people, if this had gone its course, of the 239 million, approximately 1/5 of them would have been in the class that does seem to reporting, and then the death rate does vary from state to state and even time, but it's on the order of about 1.5%. So would have been approximately 720,000 Americans would have been expected to die from this disease. And so that's what we thought early in February what it would be, with an R0 value of 1.8. And that would have been, as shown on this chart, the actual progression of the number of people that have gotten the disease. So shown there early in February, not much growth, but getting exponential growth in March. And more or less the disease playing out by May, with almost everybody that's going to get the disease did get the disease. And that's what we would have expected. However, we should probably look and see early on in this model, and so really kind of early, right around the early March time frame, we can look and see. So this is what would have been predicted in February, and I'm zoomed in now, so just so early March is showing there and lopping off the right side of the curve, and that's what we would have predicted from this model. However, in reality, this is what happened with the disease for all of the United States. So the actual data is way less. It might not even look that way in this chart, but the blue curve goes way high off the screen, and the red curve shows the actual data, which is significantly less. So what happened? What happened? Well, it turns out there was changes, social changes, and we all know that happened, but that's the effect of what happened. If we had done nothing, we would have had this tremendous exponential growth, but instead we started wearing masks and started social distancing and even stay at home, and it changed from different state to state, but by and large these are about the time scales when different things happened. So it might not look like it, but early on in this curve there was this exponential growth, and then just as little as saying things like encourage washing hands and start to consider social distancing, it actually changed. It doesn't look like much on this graph, but actually there we started changing from an exponential curve to now just sort of this linear curve, which means that instead of more and more and more people getting the disease each day, we get about the same number of people each day, which is tremendously fewer than the exponential growth. You can see then later there was this shelter in place that actually changed the slope of that curve to a little bit less than straight up. Now we're getting into phase 1 and phase 2 of reopening, and I think there's other charts later that show the effect of how well that works. Now you can see on this graph, the red data is actually the raw data. The raw data is a little bit jiggy-jaggy, so it helps to smooth it. The day-to-day variations probably need to be smoothed out. That's shown here in blue. And then the actual model, the SIR model, is shown in green, and it nailed it. It's straight on top of the data. So the SIR model with a R0 of 1.8 showed the previous graph where it went really high, but with this data now, it's laying right on top of what actually happened. The actual curve on the previous one is the number of people who are getting the disease, getting infected. It's a little bit helpful to look at the slope of that curve, and so as I was saying, this is showing then how many more people per day are getting the disease, and it shows then that at the point where everybody was told to shelter in place, no longer will we get more and more people each day getting COVID-19. Instead, it was about the same number and decreasing actually a little bit on each subsequent day. So that was the important of those changes. But again, the model match is spectacular here. But it's a trick. It's sort of a trick, because I took the data that we had and I fit the R0 value to the data so that it would match perfectly as was shown there. And so if we just plotted up the R0 value, remember anything greater than 1 early on, the disease is growing. So early on it was about the 1.8. That was more or less in early and mid-March. And then once people started doing the various social protocols, it dropped down and it got to be very low. It was on the order of 1 for quite a while. And now as we're getting here into the phase 1 and phase 2 reopenings, we can see that it is affecting this R0 value, making it climb over the value of 1. And if you just sort of put some numbers to this for the whole U.S., we already saw when the R naught was 1.8, at that point we would have expected a total of about 230 million Americans to get the disease. At nearly its lowest point, when the R naught was about 1.3, after going through this, the total number of Americans we could have expected at that point would have been about 25 million. So about 1/10, 10 times fewer than if nothing had been done. And at the time of making this, which is early July, the R naught value looks like it's for the U.S. somewhere around 1.1. And in doing so, then that says a total of 53 million Americans will get the disease. And that's predicting it out. So, what are the current predictions according to the SRI model determining how many people are susceptible, how many people are currently infected, how many people are recovered? Well, we can go from there, and now everything shown in the green shading is predicted and using an R naught value of 1.17, which at this point is probably pessimistic, but not too far off from what we can expect from the trends of the R naught that we've seen. And in doing so then, we see that these are the cases with the total number of Americans that are expected to get the disease of about 82 million people. Also probably important is there is a peak here in the number of people that get the disease of just shy of 2.5 million at any given time. So we would need to have hospital beds for that number of people. And it's occurring really right about early part of August. And now if we move on to Florida. So I live in Florida. Florida appears to be a poster child of how not to handle an epidemic, and I'll show you why. Because early on, Florida had an R naught value of about 1.8. Looked like Florida was a little bit less, but before anybody did anything, the R naught value was about 1.75. And then as other people did various social protocols to become awareness of the disease, start social distancing, do some hand washing and shelter in place, the R naught value dropped spectacularly low, actually below 1 for quite a while. And so the raw data, day to day to match the curve, is shown in blue, but a smoothing of that curve is shown in red. And Florida now was low and suffered the economic impact of social distancing and also sheltering in place, but now it is climbing back up to a value somewhere just south of about 1.25. So if we just look here, what Florida can expect for these different values, there was a low where Florida would have expected only 390,000 cases. Florida's population is somewhere near 22 million, so 390,000 cases is extremely low for this disease, and that's when the R naught value was about 0.97. Now, as time is going by, and various politicians are deciding that it's okay to reopen because of the economy, the cause of that, or the result of that really, is we're expecting now somewhere near 7.2, 7.3 million Floridians to get the disease. Remember, out of 22 million, so that's approximately 1/3. So the thing is well, we'll get to that. So the total infected number of people in Florida starting today, but then projecting out, is shown again in green from where we are now, and using an R naught value of 1.22, which is probably not quite what it's going to be, that's a little on the low side, we can expect about 7.3 million Floridians will get the disease. If we had done nothing, at all and stuck with the R naught value of 1.8 in February, then in Florida we would have got about 2/3 of all Floridians would have gotten the disease, 15.5 million. And perhaps maybe as significant is basically we would have been done with the disease in early June. You can see that the purple curve is flattening out to show that we're basically the disease is halted. There's a lot of people got it. We're into the herd immunity and nobody further gets sick. So that's if we had done nothing. It would have been a lot, an extra 7-8 million people with the implications of the healthcare system and the death associated with that. But we would have been done with the disease by now. There's another option that could have been done, and you could look at the data of the R0 value early on. There was a time pretty early on, essentially in mid-March, where the R0 value was 1.24, so it was before really the shutdown of stores and such. But the R0 value got to a 1.24, and if we had just worn masks, washed hands, and social distance, it looks like we could have maintained that 1.24, and there's reason to believe that, because essentially that's what's going on now in Florida and the rest of the country, and it does look like if we stick to these protocols we could keep the 1.24, so we wouldn't have really needed to shut down the businesses and things like that. We could have had 1.24. Now, since it was earlier on in the disease and a little bit higher number, we would have expected about 7.8 million Floridians to get the disease. So the delta between those two is 500,000 people. And again, there's a 5-to-1 ratio of the people that report, so about an extra 100,000 people would have reported, and arguably 1%, 1.5% of them would have died. So an extra 1,000 to 1,500 people had we have done that. But the economy would have fared differently had that occurred. So now we're finally done. And then the question is here, I hope there was some help in explaining how the models work. And again, there's nothing really wrong with the models. It's really what happened here is the early models didn't know what would happen with the social distancing and face mask wearing and washing hands. But ultimately then, as a society, I guess we've made our decision. I think there's good reasons to think that had models been believed earlier on, we could have made a different decision. And we certainly don't want too many people to get sick and suffer and die. So there is that side of the equation to try to minimize that. But there is also the cost of shutting down the economy. And in doing that then, there should have been some balance that we could have reached in there. That and I guess you could argue that some people say we did reach that balance. It does seem like I was saying from a Florida point of view, we could have got to where apparently we're going without that shutdown. And I guess I won't talk about the political implications for that. So that's it for my explanation of COVID-19 and the various modelings on it. And if you have any comments or anything, please leave them. And thank you very much.